Hi, my friends. My name is Dr. Prayani. I wanted to share with you this very interesting topic of dizziness. Dizziness is such a common topic, but having a systemic approach is so necessary, as this case demonstrates. I have a patient who was 23-year-old who came into the primary care clinic with not only these complaints of dizziness, uh, after already having to battle a preeclampsia and HELP syndrome. We discontinued her labetalol after AV nodal blockage was seen on a Holter monitor done in the outpatient clinic. She continued to have persistent dizziness, for which we had to admit her in the hospital, and a cardiac electrophysiologist diagnosed her with POTS syndrome with these orthostatic vitals. And instead of putting people on the beta blockers, the cardiac electrophysiologist utilized ivermectin, which has shown, as per the Heart Rhythm Society guidance, very promising benefits with this autonomic issue, which is called as POTS. She did show symptomatic improvement, however, later came back to the clinic with not only this dizziness complaints, but with this autophony, which is hearing the internal sounds complaints and this tinnitus. And dizziness being 55% of the time vestibular in nature, l- requiring us to do a CT or MRI internal auditory canal, which this imaging demonstrates of the thinning of the semicircular dehiscence syndrome, which ENT later decided to do ENGs to decide if a surgical approach is necessary. She did in the past require a lot of steroids, which may be a reason for having a low ACTH and a low morning cortisol, which Addison's maybe a dynamic adrenal testing might benefit for her. But having a systemic approach, having a T-based approach is so necessary for this very common complaint of dizziness, which can be certain times so complex, like this patient uh, demonstrates. So, thank you so much for your time.